Well, thank you, Vicky, and thank you, ECPO, for inviting me to talk about this, um, well, interest of mine about childhood obesity that I've been working on for some years. It's been insightful listening to what Mario is experiencing with his work and with children. And what I was asked to share, would like to share, is a bit more of um, how we can open a discussion with parents and children, because that's often what I'm asked of by health workers, let's say those who are there in the first line, the school nurses, the home doctors, the family doctors that see or measure that a child is growing faster than it should be. Then they are sometimes in trouble with how they can enlighten people or ask them um, what, if anything, should be done about that. So um, that's something we have worked on in our clinic, to use language that's not disturbing, because it's very important for us as healthcare workers to build a good and healthy relationship with our clients, to keep them on the long distance coming back, so we um, can help them lead the way into more healthier growth. So my main point is more or less in that angle. You always have two partners when you are a pediatrician or a kids doctor. You talk to the child, but you also talk to the parent. And both the parents and sometimes the older children come into the room with their own prejudices and with their own experiences, either from their own childhood or growing up self, or from earlier contacts with healthcare workers, or even with people in society, on the grandmas or neighbors or whoever. So my, let's say, opening line, if you want to use that word, is usually that I show people just on a growth chart that the child is growing too fast according to what the others are doing, or as I usually say, they're growing unnecessarily fast in weight. I show them that the height is growing just according to what other kids are doing, but if the weight is growing too fast, it's unnecessary. And when we put it that way, we just show them they are growing faster than the other children. It's usually not stigmatizing, and it's usually not something that we can argue on, because that's more or less a fact. The child is growing faster than the growth line is doing. And sometimes, of course, I work with children that are growing slower than the growth line, because I'm also a general pediatrician. And that's something that's much more accepted. If your weight is growing slower than expected or needed, everyone is aware of that. That's not good, but we should be just as aware that if you're growing faster than necessary, then there's usually an explanation. Sometimes you don't have to do anything. It's something that's just temporary and you don't have to worry about it. But usually it's something that's sometimes visible. Sometimes we have to dig very deep to see the explanations or understand why this child is growing faster than necessary. And in that line of language, we usually never get people against us, because we are just discussing how the child is growing. And in that way, we can build a much more healthy long-term relationship with the family, because that's what's needed. If you're working with a child with obesity, you have to follow the family more or less until they're grown up, or at least for a very long time. So if we measure a child growing too fast, that's not that's not a disputable fact. So it's much easier to discuss than if you use language like too fat or obese or something. I usually don't hesitate to use those words because for me they are just facts as well. But I know in some people's minds it can be stigmatizing, and what we need is, like the hashtag says, hashtag support not stigma. And we need to build a relationship with these families to be able to support them on their way to, let's say, healthier growth for their children. Because if kids are growing for a long time faster than the others, they are going to have problems like the grown-ups have with sugar or a lot of things, at least a large percentage of the kids. So I usually don't have to share that fact that let's say that the steady fast growth is not usually not a surprise when they come to me, but when you are a first line healthcare worker, it's usually something you have to address, that your relationship with the parents is good for a long time. So that's maybe the main point, just to have an easy opening line, because that's something that a lot of parents have, let's say, described to me later on in life, that they have had sometimes either self or on the way with a child, that just the opening line close all the doors on the on that particular healthcare worker. So if you discuss the growth of a child, it's usually not stigmatizing. So I would advise that. So on that line, Vicky, I would like to give it back to you to see how others are doing it. I look forward to see more of the discussions from Dr. Proti in Ireland shortly, and would like to wish you all luck with your work. It's nice to see how you're helping us as healthcare workers to see how support and stigma can have different effects on our relationship. Thank you.